do you want to close out your email so it doesn't keep dinging?
Yes. Okay.
You are ready to go, and I will record as well.
All set? Go ahead.
All set.
Okay, great. Thanks, Greg. Welcome to our first semi-in-person meeting. It's nice to see everybody. Yes, great. So we do not have anybody for privilege of the floor today, so I'm going to go ahead and move straight to approval of our minutes. So can I get a motion to approve minutes as written? Somebody first from Melissa and a second from Smara. Okay, any discussion? Changes? Okay, all in favor? As written? Raise your hand up. Yeah,
No, I wasn't here.
okay, that's fine. All against, and then abstentions. All right, financial summary. And just as a reminder, Frank isn't here today because he's on vacation, so.
The June 2021 financial summary is included in your packet with a very brief narrative. As it's been for a while now, we continue to see over expenditures, but it's pretty much tied to COVID-related expenses, particularly testing. So that continues to be worked on, and at some point FEMA funds will start offsetting that.
Do you have a sense of the time frame on FEMA funding, how long it's taking?
I don't on the time frame, but I know we've been paid for several projects.
Okay.
Already. Then it'll be a matter, I think they're putting it in one global account and then they'll move it in our books at some point. Finance isn't Howard, so we're good. The other is planning and coordination runs a little bit higher right now because they've been doing some on-call, which is not typically budgeted for them. Again, related to COVID. We continue to work with all our various COVID grants to try to maximize 100% revenue where we can get it versus using county funds. Nothing else?
Any other questions on budget? Okay, and is there an administrative report?
I don't think Frank submitted a report this time. No. He's on vacation.
Frank's on vacation, so no administrative report. So we'll move right to Sam then for the motion.
Okay. So it's good to see everyone in person also. Sorry about the confusion with the technology, but we'll get there. So for health promotion, we got 16 applications for the communications coordinator positions. We reviewed those and we are starting interviews. So we hope to bring somebody on by end of August. So that'll be a really great support for the department across mental health and public health. And then we also are 4 public health ambassadors have been with us again since the beginning of May, and they're actually wrapping up at the end of next week. And so I really have enjoyed working with all of them. They've tremendously contributed to our efforts over the past couple months with the vaccine outreach, and then they've all sort of focused on some different public health areas at the health department. And so I hope they'll all, in some way, we'll keep our relationship going and they can be involved in different ways. And one of the ambassadors is who really has experience as a community health worker at Finger Lakes Community Health. She is really helping me these last couple of weeks develop more of what our permanent community health worker program will look like going forward. So it's really exciting and going really well. So I'm going to keep all of you updated.
Okay, Dr. Krayfek, who's on screen.
Hello, good afternoon. Can you hear me all right?
Yes.
Good. Well, as you saw in my report, The COVID status was as of about 12 days ago. And as you know, with COVID, things can change. So in this past week, we had a couple of experiences. We experienced a new low for current active cases. We went down to about 4. But we quickly followed by an uptick in cases that is persisting. And as of today, I'm told that we have 10 cases that we're doing case investigations. Our active cases rose to about 17 as of yesterday. And our youngest case was in a child less than 12 months of age. We've also seen persistent people in the hospital, 1 or 2 usually at a time. And the origins remain basically similar to what we have, what I have in my report. Uncomfortably, we have had more than what I would expect in terms of cases in what we think are fully vaccinated individuals. And what this means is difficult to say when you have low numbers. And as you know in my report, and continues to be true today, the protection of all of our vaccines against variants is still judged to be excellent. And there is no recommendation for additional vaccine doses. In that vein, I might mention that the media frequently misuses terminology. They often talk about boosters. When you talk of a booster, you're talking, technically speaking, about an additional vaccine dose, which is basically the same as the original vaccine given in order to raise antibody levels above what you know from data will become levels that are too low. So we give a tetanus booster basically every 10 years in order to keep people's tetanus antibody level above a certain minimum. When you, the media is often talking about extra doses in order to increase protection against variants. And Pfizer has made noise about a dose against variants. That, technically speaking, is a supplemental vaccine. It is not boosting it is not principally given to boost the original antibody levels, but it is to induce additional antibodies against variants. At this point, there's no recommendation either for a supplemental vaccine or for a booster vaccine. When we look at New York State as a whole, in this past week, cases have increased. When you look at it in a further breakdown, those increases are largely in New York City, Long Island, the Capital District, and Mid-Hudson. Central New York, which think of Syracuse, has a slight rise. We are not in Central New York, we are in the Southern Tier. And the other regions of the state are fairly flat in terms of case charting. If you look at cases per 100,000 and you look at the Southern Tier, we used to be sitting back not so long ago, a couple weeks ago, at about 0.97 at the nadir. Most recent report is 2.96 cases per 100,000. And that's obviously an uptick. If you look at New York State, for context, the nadir was about 1.66. We are now, as a state, as a whole, at 8.14 cases per 100,000. The question, of course, is where are we going to be in a month? You, of course, must say that this trend is not favorable. Again, predominantly the cases are in the unvaccinated, but as I mentioned, we have seen unexpectedly more cases than I would expect and what we consider to be fully vaccinated. In terms of what happens during the summer, we all know about summer camps, overnight camps and day camps. One case in Broome County was the first in the southern tier that we know of. That resulted in 80 contacts. And we should be fully aware of any camp cases in the course of our case investigations, because we always inquire about the setting and we log the site of the exposure in the state's database when we do it. With regard to testing, as you know, testing has gone down as the pandemic ebbed in the state and in our region. However, using the state's dashboard and the benchmarks, we are still, for the southern tier, at about 2 to 2.5 times the minimum that the state would deem prudent for COVID testing. That is a rate of about 30 tests per 100,000 people. We are at about 2 to 2.5 times that. With regard to sequencing and what is happening with variants, as you, I'm sure, have read in the media, the Delta/India variant has become the dominant strain. The most recent data for New York State is that it's in the range of about 80 to 83% of the variants that are being seen. And that is on par with the national statistics for the Delta variant. The sampling and sequencing that we have been privileged to have in our region due to the research project that has been conducted and is being conducted at Cornell is ongoing, and all positives that are technically satisfactory to be sequenced are being sequenced. Our last report on our regional numbers now is more than 6 weeks old, and we anticipate an update in the coming month or so. But regardless of that, I think we can infer from what is going on nationally what we probably are seeing here. In addition, it is still true that the methods by arriving at a clinical diagnosis and evaluation and the care to be delivered subsequently is not influenced by the variant that infected an individual. What is important is that the Delta variant is at least twice as communicable as the United Kingdom variant. And what is true is that most of the cases predominantly across the country and in New York State are amongst the unvaccinated. And what is true is that as a nation, we have not achieved the level of vaccination to stop the pandemic, and even more importantly, to stop the creation of variants. The variants are a major risk for us and a major risk to even the vaccinated. And so none of us can feel comfortable about this current situation. Well, we have succeeded in our county in achieving laudatory vaccine levels. That isn't true for our region as a whole, nor for our country. And unfortunately, the variants find fertile ground to infiltrate throughout our communities, particularly using the pathway of the unvaccinated. The people who are being hospitalized, who are becoming severely ill, unfortunately who are dying, are amongst predominantly unvaccinated individuals. On a recent radio interview with WHCU, I was asked what my words would be for people with regard to considering vaccination. And I said, you don't have to believe me. You don't even have to believe the scientists. You just need to look around. You just need to pay attention what's happening, not only in the country, but in your region. Look at who's getting sick, look at who's in the hospital, and unfortunately, look at who's dying. That is a powerful message. And I truly hope that all of the people who are not vaccinated yet will look around and seriously consider. We don't know what the coming month or two will bring. I know I'm painting a rather dark cloud over us, but this is the way we are. When I was asked what my prediction would be for the end of August, September, I said, we don't predict with COVID. We prepare, we stand ready, we marshal resources, we monitor carefully, and we're prepared to act as it needs to be. And that is where we need to be at this time. I would add a further note that I'm often asked, what should vaccinated individuals do with regard to masking and social distancing? When I get in the car, I buckle up my seatbelt. I don't presume I'm going to have an accident, but I know that that seatbelt is important to me should something untoward occur. I'm vaccinated, but if I'm going to step into a situation that I don't feel completely comfortable with, a mask is like my seatbelt. Social distancing is like my seatbelt. So if I'm going into a group of people that I can't be very, very confident that they're careful as I am and they're vaccinated, I think that mask has a role to play. And so I tell people, when the risk is not worth it, use the benefit of your mask and use it. We hear a lot of discussion about masking and what the CDC guidance is and what New York State guidance is, et cetera. That guidance in the recent week or two has not changed. But guidance is one thing, and assessing your personal vulnerability and taking prudent steps. It's not very difficult to wear a mask. I think that individuals who deem that their risk is at a level such that they should employ one should do it. I'm glad to answer any questions. I, of course, am expressing my personal opinion on that matter. It's not department policy. It's not New York State policy to talk in the vein that I just did. But I think we often are called upon to give our best reading of the tea leaves, if you will. And that is what I'm doing.
Thanks, Dr. Kipek. Any questions? Comments? Okay, so sort of sobering news. So I hope everyone listening is taking heed of that advice.
I have a question. The vaccinated individuals who are testing positive, are they symptomatic, or have there been some asymptomatic individuals too?
There's a mix, Melissa, as you might imagine. Some have been symptomatic and others, particularly if they were discovered on pre-procedural testing, would be asymptomatic. We may have more information on that as we're going forward, because now that we're looking at this change in the weather, if you will, we're paying even more attention to the circumstances and collecting numbers about these types of things.
Thank you.
Other questions? Thanks. So since Celeste is on vacation, I was just, are you talking to her or, okay.
No.
So we'll catch up with her next meeting. And then Deb is here, right? She's on screen. Deb, did you have anything in addition to your report?
Yeah, I just wanted to make note that we haven't been needed for COVID in case investigation for quite a few weeks. A few of my nurses are still helping cover on call for evenings and weekends. And then the only other thing I wanted to mention, you'll notice at the bottom of my report, I wanted to point out a retirement. Barb Wright, who's been our administrative coordinator, one of our managers on the unit for 30 years, has retired. And I just wanted to thank her for her years of dedication to our programs. She's also staying on for a few weeks or possibly a couple months to help us transition our new administrative coordinator, who's Kayla White. And that's really all I wanted to add from my report.
Great, thanks, Deb. Congratulations to Barbara Wright on our behalf. Thank you for sharing that.
Could I, on the subject of retirements, could I mention one other thing?
Sure, of course.
Many of, I shouldn't say many of you, I should say some of you may remember that Dr. Jeff Snedeker served on the Board of Health for many, many years and was president of the board in his term. And he has just retired from private practice. Although I'm assured by him that he's going to continue to do some infectious disease consultations and also be available should we have questions of a public health nature, for which I'm very grateful because I've often reached out to him, especially these last 18 months, to get his input on one or another matter. But I thought the board should be aware that that an individual who served the board in a very, very dedicated manner and who holds public health very close to his heart has retired from his private practice.
Thank you. Jonathan.
Yeah, maybe I'll take a couple minutes to explain the open meetings law and
Okay.
how that relates to us, the Board of Health. So the open meetings law covers public bodies, and the Board of Health is a public body under New York law. And under the executive order, the governor, for a long period of time, suspended two aspects of the open meetings. One was that members of the public body meet in person. And the second is that the meetings be open to members of the public. Then one day, without really any warning at all, the executive orders went away and the open meetings law was back in effect, which means two things. It means that this board, when it meets, all members who participate must be here in person or wherever it is. And it also means that these meetings need to be open to the public in the physical sense that any member of the public can come in and watch the meeting. What you have and why we have this is that, we went through a period of having Zoom meetings. A lot of people like that, thought that there was some advantage to that, and figured that we should continue that to the extent that we can, or at least make that available. So the ability to participate in Zoom, and obviously we're still working on the technology and getting it into every place, but we have it here, we have it in the boardroom of the legislature, is to make it open to members of the public as well as to staff to participate that way, because the law does not apply to staff. Staff don't have to meet in person, but members of the committee do. So that sort of explains, and obviously we're going to expand this. It should be one in the Rice conference room sometime, I expect. And probably that's going to be a fixture that's going to last for a long time, because people seem to like it, and it's an advantage to staff to be able to appear remotely. And even after, hopefully this pandemic goes away, it's very likely that this process will continue because people like it. So be happy to answer any questions about that.
Thanks, Jonathan. Any questions? Liz, environmental health.
Forgot, I had to double click both the video and the sound. So actually, I don't have anything to add to my report. Do you have any questions?
Any questions for Liz on her report? And then also, did everybody get a copy? I'm moving on the agenda, that's the CSB report. So there was Harmony's unable to be here today, but there's a write-up. So if you could take a look at that and then maybe reach out directly to Harmony if you've got any questions, because I don't have the information to answer. Okay, Liz, I'm gonna come back to you for the administrative action that we have to take for the Lions Club.
There's the 2022 budget.
No, I've got the Lions Club first.
You want to do Lions Club first? Okay.
We're gonna lose Shauna here in a minute, so.
Okay. Yeah, sorry if I missed that.
So it looks like we're being asked to approve a waiver for the use of a holding tank at the Lions Badger Camp. So can we go ahead and put this under a motion before we start discussion? So I've got first from Shauna, and a second from Dr. Pei about approving as written. So Liz, can you go ahead and let us know anything in addition that we might need to know?
It's pretty much what was, I think, hopefully in the memo, that they have to have this one facility and they want to, add a bathroom and hand wash sink in the event that the facility has to be used, which sounds like a good idea since it's emergency response type stuff. And it's not in a good location to put in a sewage system. And so we would support approving use of a holding tank in this instance.
Great. Any questions for Liz on this? Okay. So all in favor is written. I think that's unanimous. Any opposition that I'm not seeing? No, I think that's unanimous. Okay, great. So let's move on then to administration and the 2022 budget. Is this you?
So there is a very short, brief worksheet that we've done for years regarding our 2022 budget. There are no staff losses in this budget. There are a number of OTRs, which I'll kind of highlight for you at the end. In the, I don't know if yours is gray or yellow square at the bottom, you'll notice that we are short on our fiscal target by about $36,500. We are in the midst of doing a bunch of the integration work. And it's starting to reflect in our budget. So the mental health portion of the budget is actually got $36,500 some dollars of target money that's going to get moved here. It just had not happened as of this printing. It probably will happen before it goes to the ledge. So there's a number of positions in both departments that are starting to kind of cross over and do work in both. And things are starting to fall together in that planning. Otherwise, the health department has 10 OTRs, half of which are funded by our rollover money, and the other half are target requests. So I'll kind of go through them just generally, what they are and what their cost is. The first priority is a new initiative for community health workers, which Sam mentioned. And the proposal is to hire 2, and the local share is estimated at about $103,000. I'll just round it up for the community health workers. Do you want any more detail or just kind of summary of what they are? Sam can speak to what the intent is, but I think she did a little bit of a summary early on.
I was wondering if that's living wage.
It is, so it's county employees, so yes.
Yeah, and there's a whole job description that's on it's on the Human Resources website actually, and so it's a grade, in the county, or in civil service structure and everything. Yeah.
And they'll be eligible for benefits. They're full-time positions.
Yeah.
We also have 2 slated in the school grant, which we're still waiting for final approval on from the state funding arm. So it's a COVID school grant for grades K through 12. And we built 2 in there to do some outreach work for that. The next one is also is priority 2. It's for a public health sanitarian for services. I'll let Liz, if she would like to comment anything on the specific work. The estimated county share is $65,000. Liz, do you want to comment any on the core sanitarian?
This is something we had wanted to request prior to COVID. And then instead we ended up for a short time reducing staff. So it is something that has been needed for a while. So I really don't have anything else. The need is certainly not diminished. So I don't have anything else to add. I can answer questions. This was it was, sort of connected with the inspection policy that we brought last month.
The third is an increased hours for the admin support team, which is 4 staff. And that is my team of administrative support. So one of the first 2 areas of integration is in administration. And my staff will be looking at providing all the same kinds of services for the mental health department. So mental health currently has their finance person and 1 administrative person trying to do things that we have multiple people for. In addition, we had 2 information aides, and we lost 1 in 2020 with the COVID situation. We had to make some budget reductions. We did not replace that position. One of these folks will be a primary support to the front desk for vacations, lunch, breaks, so on, versus filling another position. I thought this was a much more cost-effective way and still be able to support mental health.
So it sounds like some things with mental health are merging financially, some things are not, but both departments now have distinct budgets and you're just kind of putting things in one pile or another. Is that what's happening?
Doing the best we can to make things work right now, but next year's goal, Jeremy Porter and I will be working on the merging of the chart of accounts and how will that work, because we both have different state regulations and so on. But we'll be looking at the bigger picture of the financial system next year.
Thanks.
And the cost on that one, local share, is about $22,000. The 4th priority is an administrative assistant level 2 for environmental health. They have had 3, and I think prior they had 4. So they are looking to fill a full-time administrative assistant. The local share on that is $41,600 and some dollars. Liz, again, if you want to comment.
I don't think I have anything to add. We currently have a half-time position budgeted in our current budget. And so we want to put that up to a full-time position. The OTR is actually for the full-time position, not an additional half-time because of how those numbers work or whatever.
The 5th OTR is public health sanitarian for water resources. The local share on that is about $64,000. Liz?
This is a position, it's that there has been a lot of community interest in, particularly from the Cayuga Lake Watershed Intermunicipal Organization and the Tompkins County Water Resources Council. They have wanted a position to focus on things like watershed rules and regs and just improving things. And and in terms of water quality in the watershed. We have, at the health department and environmental health, we've been unable to focus on these issues only at a minimal level and none during COVID. And so this would give us the ability to, we're an integral part of watershed rules and regulations. We also want to revise our Tompkins County Sanitary Code, especially like the on-site wastewater treatment system program. There's a source water assessment program for water supplies with DOH that we haven't been able, we started getting to work on and haven't been able to continue activities on. There's drought preparedness and conversations with water supplies. So this position would be focusing on a lot of these kind of water resources related issues.
I actually thought that last year we allocated funding for this position.
I was out, so I
Okay.
don't know.
Liz, did we allocate funding last year for this position in an OTR?
No, last year we had budget cuts.
Yeah, I know, but I think I felt this came forth as an OTR.
So I think it was last year. I sometimes get the time frame confused because of what happened with COVID, but I don't know if it's the IO or the Water Resources Council, they brought a position description to Jason
Okay.
in a previous year. I did not think it made it into the actual budget process, but the conversation certainly started in a previous year, either 2019 or 2020 for those 2020 or 2021 budget cycles. This position is a little bit different in that the IO wants somebody who can, one of their big concerns is having somebody who can help with these numerous grants that are available for stream bank restoration and other similar types of projects that are kind of more location specific. And that would not be our immediate priority. Our priority would be more on these larger issues like the sanitary code and possibly watershed rules and regs and source water assessment programs and droughts. So I think that would keep the person more than busy. There are others on the list.
And the last 5 OTRs that we've submitted are again funded by the county's rollover. The first priority is rabies post-exposure treatment program. We have come into some issues with our program during COVID and prior. Convenient Care Center had been taking on most of our rabies post-exposure. Convenient Care Center has closed. So they're looking at immediate care. So we have made some budget reductions based on the way services had been running, but are now trying to sort that all out. So we put in funding for that, both in professional service fees and biologicals to purchase vaccine while we continue to work through that whole situation. The next one is the Public Health Sanitary Code Consultant. This is a 2-year proposal. So we're requesting $50,000 for next year, and in 2023, we expect to be needing about $25,000. Liz has already kind of mentioned it, but our sanitary code is in need of updates and amendments, and it is a lengthy process to go through. So we're setting aside some funding to try to get that correct. The next one, and again, and stop and think what year, in 2019, I think, we held the public health, mental health integration meeting, an all-day meeting for both staffs. We're proposing to do that again because we'll be by 2022, we'll be much further in the process. So we have put funding aside to hold another event with our consultant and the integration of our staff. And, I think the last one was well received, and we think in 2022 it'll be time to do that again. The next one is $30,000 for the new maternal child health program launch. So it's for mostly public information type activities, and the plan has been drafted and is being put together now, and they're looking for a new name. I think that's on their website. And so this is some money to get some promotional information out for every new mom in the community, not just our Medicaid eligible population. And the last OTR is the HABS database project with the Community Science Institute. And that is proposed to be partially funded this year with additional funds next year to make the HABS database web-based and public facing. So we'll be working with Community Science Institute to make that happen. That is our OTRs that have been submitted as part of our budget.
And so how does all the COVID stuff fit into this? Like if we have another situation where we're pulling staff from all of these different places again, how does that fit in? And why aren't we accounting for that as a possibility?
We've gotten a lot of grants that have offset those expenses. We don't know what will happen. I don't think we will just routinely budget. We'll go to contingency. If we have needs, if they're existing county employees that we're paying, they're already budgeted. So they'll be reassigned, which is what happened with a fair number of folks. If we need to pay for additional staffing, then we'll be working through it. See what kind of grant funding comes along. Frank hasn't asked me to put any money in for COVID yet, so.
I mean, we've had a whole year, over a year of not doing other public health work. So I think that would just be the concern, is that while I recognize that we can reallocate people from other areas, it also means that the work that those people are supposed to be doing doesn't get done. So I would just be concerned about continuing to not address some of the other important public health issues in the community.
When Frank's back, I can raise the question if he feels like we should have a COVID OTR, and how would you want it in the budget or in contingency?
Or just plan for, yeah,
Or
somehow.
plan for,
Yeah, so that we don't have to continue to not do other important public health things.
sure.
But that's just my opinion. I don't know if other board members have other thoughts on that, but I think that we've put a lot to the side for a long time, and it's getting to the point that I think it would be not good to continue to ignore some of these important issues.
Also, the governor announced that public health war, and each local health department had to fill out a survey and express interest in receiving the fellows that they, there will be a certain number assigned to each county. So I believe we may have up to 7 of those fellows. So it's something that might contribute to ongoing, other, all public health issues, but any pandemic response as well. So
That's good. So we might have 7 coming in to do that. Oh, that's great. All right, any other questions on budget?
So the budget has been submitted. We met with Lisa Holmes, who's the interim county administrator. We don't expect to hear anything until right before she releases to the legislature, which is typically around Labor Day, the first Monday, first Tuesday in September. They usually get the budget. County admin recommendations.
Okay. Any other thoughts or questions?
Do they give you any feedback before that in terms of what they think they're gonna present or not present to the county?
Yes, we will get some kind of feedback typically just before she's going to release it. We met, didn't get any feedback at that point. Answered questions, but not that's a really great idea. We should fund that, or no, no feedback in that sense. I'm sure she's gotten many OTRs this time around. Plus they have the ARP funds that they're looking at.
Might want to add, we have a new budget person who started yesterday, so. So I think the county administrator was kind of holding off giving opinions.
Kevin's last day was last week.
Kevin's last day was,
Friday.
yeah, it was last week, I think it was Thursday, Friday. The new person started yesterday.
All right, anything else? I think we've covered all of our agenda items, so go ahead and adjourn. I guess we don't have anything else to discuss. All righty, I know. We can make some things up for you. Okay, well, great, so we'll see everybody end of August, right? All right, have a good,
It's likely gonna be here, but we'll let you know.
okay.
Our
Enjoy.
equipment like this won't be in, I think the delivery is now like September.
Greg, is there anything I need to do before I end the meeting?
You have a.
No, I'll take care of it from my end.
Okay, thanks so much.
We had Shauna, but it was